Hello everyone, I hope you're doing well. Welcome. The purpose of this video is to help you apply what you've learned about conjugating regular AR verbs in the present tense. Be sure you've studied the topic in your textbook. Be sure you've watched the grammar tutorial video. You can also Google the topic and you'll find some great YouTube videos that describe how the conjugation of regular AR verbs in the present tense works. When you're ready to apply what you've learned, then come here. So let's go ahead and get started. Remember, there's no way of getting around the memorization of the endings, the AR endings in the present tense. So you have to memorize these endings and be sure that each ending is associated with its subject pronoun. Once you do that, then you're ready to go. So let's go ahead and go to the practice. So what we want to say here is I take aspirin. Aspirin's a little tricky in English because you can use aspirin for plural, or you can also add an S and say aspirins. So in Spanish, this is the plural, aspirinas. So I want to say I take aspirin or I take aspirins. ¿Cómo se dice? Tomo aspirinas. Remember, the yo is unnecessary because of the ending. The o tells you that that's the subject. So many Spanish speakers will leave out the yo. Tomo aspirinas. I take aspirin or I take aspirins. Ella, she takes aspirins. Ella toma aspirinas. Ella toma aspirinas. She takes aspirin or she takes aspirins. Tú, dos aspirinas. You take 2 aspirin or 2 aspirins. Tomas 2 aspirinas. Tomas 2 aspirinas. You take 2 aspirin. And be careful with this. I know it looks like the Spanish word for Thomas. But for the word for Thomas, the name will have an accent mark here. That would be Tomás. But this is Tomas. We're putting the stress over here. Tomas 2 aspirinas. You take 2 aspirin. Tomas 2 aspirinas. Now I want to ask you the question, do you take aspirin? It's informal. This is a question I would ask someone I know well. ¿Tomas aspirinas? ¿Tomas aspirinas? Do you take aspirin? So how would you say the patient takes aspirin for the pain? Para el dolor is for the pain. El dolor is pain. El paciente toma aspirinas para el dolor. El paciente toma aspirinas para el dolor. The patient takes aspirin for the pain. El paciente toma aspirinas para el dolor. ¿Cómo se dice the patients take aspirin for the pain. Don't worry about getting tongue-tied sometimes. It just happens to everyone. The patients take aspirin for the pain. Los pacientes toman aspirinas para el dolor. Los pacientes toman aspirinas para el dolor. Now here we want to say you take aspirin. Usted toma aspirina. Usted toma aspirina. So here we want to ask the question, do you take aspirin? Como se dice, do you take aspirin? And we're using usted, the formal you, which is what you'd use with your patients. Toma usted aspirina. Toma usted aspirina. Note that if it's established, if you've been asking a patient questions and you're using usted, you can leave out the usted after the first question. You could just say toma aspirina because it's understood that you're addressing the patient directly. They understand you're using usted even though you leave it out. So you could say toma aspirina, meaning do you take aspirin? Now here you want to ask, what do you take for the pain? What do you take for the pain? Notice the word que, which is what. ¿Qué toma usted para el dolor? ¿Qué toma usted para el dolor? ¿Qué toma usted para el dolor? I take a pain reliever. Un analgésico. Analgesic or pain reliever. Como se dice, I take a pain reliever. Tomo un analgésico. Tomo un analgésico. Okay, well that's it for this video. Remember, if you didn't get them all right, go back to the beginning of the practice part and just keep playing it until you are able to answer them all correctly, and then you've really learned something. That's it for this video.